Gen Z, born between the mid-90s and the late 2000s. Digital natives, shaped by the internet, smartphones, and social media. But behind their tech savviness lies a troubling truth. Gen Z is the most depressed generation yet. Statistics paint a stark picture. Depression rates for Gen Z are significantly higher than those of previous generations. This isn't just teenage angst, it's a full-blown mental health crisis.
Since 2011, there's been a steady climb in mental health issues among young people. Depressive symptoms, suicidal thoughts, suicide attempts. The numbers are alarming. Nearly 1/3 of high school students reported struggling with their mental health in recent years. The COVID-19 pandemic exacerbated these issues, adding fuel to the fire. Lockdowns, social isolation, and disruptions to education and healthcare took a toll on everyone, especially young people.
This generation faces unprecedented pressures. We are acutely aware of climate change, political polarization, and social injustices. The weight of the world rests heavily on our shoulders. The uncertainty of the future breeds anxiety. Many of us worry about finding jobs, affording housing, and paying off student loans. The American dream seems increasingly out of reach.
The economic landscape for Gen Z is bleak. They are entering adulthood during a time of immense financial strain. Rising living costs, stagnant wages, and crippling student debt create a perfect storm of economic anxiety. Over 80% of young adults are renters, facing a housing market where rents have skyrocketed while incomes have stagnated. Many struggle to make ends meet, let alone save for the future.
The cost of higher education has spiraled out of control, leaving many graduates saddled with enormous debt. The burden of student loans limits their options and casts a long shadow over their financial future. The COVID-19 pandemic exacerbated these economic woes, leading to job losses and financial instability. The pandemic's economic fallout hit young people particularly hard.
Beyond their personal struggles, Gen Z is acutely aware of global challenges. Climate change, political unrest, and social injustices weigh heavily on their minds. They are bombarded with news of environmental disasters, humanitarian crises, and societal divisions. This constant exposure to negativity fuels feelings of helplessness and despair. Gen Z has grown up immersed in the digital world. Smartphones, social media, and the internet are integral parts of their lives. While technology offers many benefits, it also presents unique challenges to their mental well-being.
Social media, in particular, has become both a blessing and a curse. It can foster connection and community, but it can also fuel anxiety, depression, and body image issues. The constant pressure to present a perfect online persona can be damaging to self-esteem. Cyberbullying, online harassment, and the fear of missing out are ever-present threats. The curated highlight reels of others' lives can make young people feel inadequate and envious.
Spending hours scrolling through social media can disrupt sleep, fuel anxiety, and contribute to feelings of loneliness and isolation. The constant barrage of information and notifications can be overwhelming, leading to digital overload and burnout. Beyond social media, excessive screen time and gaming can also have negative consequences. Gaming addiction is a growing concern, leading to social isolation, sleep deprivation, and academic problems.
The rise of generative AI presents both opportunities and challenges. While AI can be a valuable tool for learning and creativity, it also raises concerns about misinformation, deepfakes, and the potential erosion of critical thinking skills.
Seeking support access, affordability, and the fight for mental wellness. Recognizing the mental health crisis among young people, there have been some positive strides in improving access to care.
Telehealth has made it easier for people in remote areas or with limited mobility to connect with mental health professionals. The expansion of Medicaid coverage under the Affordable Care Act has helped some young adults gain access to mental health services.
More mental health providers are accepting Medicaid, increasing options for low-income individuals. Schools and colleges are increasingly offering mental health resources and support services to students.
However, significant barriers to care remain. Affordability is a major obstacle. Many young adults lack health insurance or have plans with high deductibles and copays, making mental health care financially out of reach.
There is also a stigma surrounding mental health issues, preventing many from seeking help due to fear of judgment or discrimination. The mental health workforce shortage exacerbates these challenges, leading to long wait times for appointments and limited access to specialized care.
Cultivating resilient stories of hope and resources for healing. Despite the challenges, there is hope. Gen Z is also a generation of incredible resilience, empathy, and activism. They are breaking down stigmas surrounding mental health and advocating for greater awareness and support.
Many young people are finding healthy coping mechanisms through exercise, mindfulness, creative pursuits, and connecting with nature. Support groups and online communities provide safe spaces for sharing experiences, seeking advice, and finding solace in shared struggles.
It is crucial to highlight stories of resilience and recovery. Sharing positive narratives can inspire hope and empower others to seek help. Resources such as the National Suicide Prevention Lifeline, the Crisis Text Line, and the JED Foundation provide immediate support and guidance to those in need.
By fostering open conversations about mental health, promoting help-seeking behaviors, and advocating for systemic change, we can create a more supportive and empathetic world for Gen Z and future generations. Remember, you're not alone. Reach out, seek help, and embrace the power of resilience.
Subscribe to the Skyway Academy for more insightful content on mental health and wellness.